Well, good afternoon. We're all doing our part in the fight against this virus. We're all doing our part to slow down the spread. But slowing down the spread isn't enough. The key to beating this virus once and for all, the key to getting things back to normal is finding a vaccine, finding a cure. Because until we find that vaccine, the fight isn't over. And that's why over a month ago, we made a strategic investment. We put $20 million towards Ontario-based COVID-19 research projects. We armed our best and brightest with the funding and the tools they need. And we made that investment because I believe in the people of this province. Ontario, as I've always said, has the best and brightest in the entire world. We're a place for big ideas, and we can achieve whatever we put our mind towards. From insulin to stem cells to open heart surgery to HIV prevention, Ontario has pioneered life-saving vaccines and treatments. And our incredible scientific, research, and post-secondary community has stepped up in a big way. They've put up their hands. We've received proposals from every corner of this province. And today, I'm proud to announce that we're moving forward with 15 of the most promising proposals as part of the first phase. Proposals like a new rapid testing method put forward by St. Joseph's in Hamilton that would enable 6,000 tests per lab a day. A McMaster study of recovered COVID patients if antibodies remain and continue to fight the virus. A food security project by Western University to study how food retail businesses are impacted by adapting to COVID-19. And a University of Guelph proposal to advance a vaccine. My friends, any of these are groundbreaking projects. They have the potential to be a game changer, not just for Ontario, but for Canada and the entire world. And I want that vaccine to be discovered right here in Ontario. I want us to be the global leaders in this fight, and I know we will be. Ontario is leading the country in clinical trials for COVID-19 treatments and vaccines. We have over 20 trials happening right now. 11 of those have already been approved by Health Canada. Our world-class hospitals, universities, colleges, and brightest innovators are working together and leading the charge. My friends, there's nothing Team Ontario can't do, and we will get through this together. Thank you, and God bless the people of Ontario. Now I'll hand it over to Minister Romano.
Well, thank you very much, Premier, for that introduction. And I want to begin by just reiterating that 4 weeks ago, I did stand before you as your Minister of Colleges and Universities. I'm responsible for research and science in the province of Ontario. I stood before you to announce that Ontario was funding $20 million, additional dollars, in COVID-19 rapid research funding. The dollars were explicitly geared towards serving and empowering and supporting the great work being done by our world-class, best-in-class research facilities and post-secondary institutions in the province of Ontario. Really, our goal were three things. We wanted to empower those institutions across the province. We wanted to support those institutions, and we wanted to leverage the strengths that we know they bring, and we know that they have that world-class expertise. And so we wanted to leverage that to be able to help Ontario in our fight against COVID-19. And as the Premier just announced, we are funding $7.2 million at this time. It is only the first announcement of COVID-19 research funding. There is still more to come, and I look forward to me being able to provide you that information in the future. But this $7.2 million was focused on proposals that had a legitimate chance of success and that could produce immediate results. And that was a principal goal that we had for the work being done through these research proposals. And that was of critical importance to us. It's also important to stress to you the importance of something that, while not always an impressive term to speak about, it's commercialization. And to put it in its simplest of terms, we want to ensure that when Ontario researchers come up with a breakthrough that is funded by Ontario taxpayers, we want to ensure that the people of Ontario are the first ones in line to gain those benefits. It's also important to speak to you about the process of this entire fund. We have taken a process that would usually take 12 to 18 months, and we have managed to reduce that to a 3-week process while maintaining the integrity of the system and ensuring that there is independence in it as well. This is an incredible feat of modernization that has been achieved by our research sector, by the Ontario Research Fund Advisory Board, chaired by Dr. Jack Galdi. And I really want to thank our peer review committee and Dr. Galdi for the incredible work that they have been able to do at not only creating a modernized process to approving these proposals, but ensuring that the integrity and the independence of that proposal process has been maintained throughout. Thank you again for the incredible work, and I look forward to further announcements that will speak to incredible work that our province is going to be able to do in vaccine development, drug trial and testing, as well as diagnostics. I look forward to being able to share more with you in the future. Thank you.
We'll go to the phone line for questions. First question.
First question comes from Travis Denrush from Global News. Please go ahead.
Hi, Travis.
Hi there, Premier. Good afternoon. So for the past month or so, or even longer, you've been saying that you want to see the testing numbers increased and that you were going to be on the health table, and you were like a dog on a bone when it comes to this issue, and you assured the public that these targets would be met. They're not being met, and Ontario continues to lag behind most of the rest of the country. Why then should Ontarians feel safe going back to work or even going into a store if the province doesn't have an accurate picture of what we're all facing?
Oh, good point, Travis. I was on the health table this morning, and what I've asked and what I want, there's a difference between what I want and what's going to happen. Hopefully it's going to happen because I have the confidence in public health. I have confidence in Ontario health. What I want to see people being tested. And if you have symptoms, please go to an assessment center. I repeat it, if you have symptoms, please go to the assessment center, because a lot of people, we don't seem to see the traffic through the assessment centers. But what I want to see truckers tested. I want to see taxi drivers tested. I want to make sure the long-term care. We can't just test everyone and walk away. We're going to be testing all long-term care once again, the frontline healthcare workers. We want to go into areas of the automotive sector and start testing people in the automotive sector right across the province. I want to see food processing plants being tested. That's what I want, and I'm confident it's going to happen. As sure as I'm standing here, we're going to make sure we ramp it up. Can I give you an exact date, Travis? I can't. I'm pushing the table as hard as I can. Is it frustrating? It's frustrating. Believe me, it's frustrating. But in saying that, I do have confidence in Ontario health and with the public health. But that's what I want, and that's what we're going to get to. We'll have more information next week for you. But to tell you I'm pushing them is an understatement. And we'll get there.
Premier, what's the response when you say that you want to see, truckers tested, etc.? Are they saying that is feasible, and what are they telling you is the main hurdle why the capacity is there, but they're not reaching the targets when it comes to the numbers? What's the response?
Well, it's feasible. They're coming up with a plan. They're going to lay out that plan, hopefully sooner than later, to myself and Minister of Health, and get a plan going. That's what we have to do. We can't just be testing people with symptoms. We have to start going to the broader public and start testing as many people as possible, asymptomatic people. And until we do that, in my opinion, and I'm no medical expert, I've said it 1,000 times, but until we do that, we can't get our hands around the whole system. How do we know how many asymptomatic people are out there right now? But just if we keep testing and tracing and testing and tracing, we're going to get it done. And again, I have confidence. Am I frustrated? Yeah, I'm frustrated, but I have confidence in the team. They're working hard. They're doing everything they can. We'll hit those numbers, and I will not. I'll be like an 800-pound gorilla on their backs every single day if I have to until I see these numbers go up.
Next question.
Next question comes from Lucas Meyer from News Talk 1010. Please go ahead.
So, Premier, I just want to follow up on a bit of what Travis was asking there, because you just mentioned that there's going to be more coming next week, some sort of announcement next week.
Well, that's what I'm asking. Sorry, Lucas, for interrupting. I apologize. That's what I'm asking. They're saying they're going to come back with a plan. I'm confident they'll come back with a plan, and it's all hands on deck. We need to get out there and test. It's critical.
Is that plan, Premier, going to include a guideline or a strategy or a date for? It sounds like what you're describing is obviously random testing. So is what you want, is the plan for that to be laid out next week, including random testing? Because if we're not hitting capacity right now with with just people with symptoms, are we going to actually have a plan, a date to, we want random testing, I want random testing by this time?
Yes, that's correct, Lucas. And what we're focusing on random testing, as I mentioned, let's go to the trucking association that's been begging to get tested. Let's go covering every Uber, every taxi driver, every limousine driver. Let's get them tested. Let's go into the food manufacturing facilities, these large facilities, get them tested. Go into the automotive sector. Go to the big 5 plants. Go to the Magnas of the world. Sit down with them and start testing people. We have to do that. It's absolutely critical. And so they're going to have a plan. We're going to move forward. I'll have more information next week. But as the questions you asked me, I'm asking them too, and I'm not going to stop until we see these numbers go up.
Next question.
Next question comes from Mike Crawley from CBC News. Please go ahead.
Hi, Premier. I wanted to ask you about the trends in the number of new cases, basically since about the past 9 days or so. The trend is actually going up, which is obviously the wrong direction. At what point do you need to reconsider whether to actually go back and put some further restrictions back in place and slow down the reopening?
Well, Mike, I won't hesitate to do that if the numbers continue to go up. I'm relying on our Chief Medical Officer and the health table to give me that advice. And we've seen it go up over the last, I think it's 5 days now. And the testing, actually, the numbers haven't been there. So that's concerning. I'd understand it if we were testing 25,000 people or 20,000, the numbers creep up and per capita it's down, but that's not the case right now. So it's concerning, but I'm going to rely on medical advice, which I always have been, and I always will rely on medical advice and the science, always.
I wanted also to ask you a separate question about Service Ontario offices. Most of them in the province are closed, but there's one in Ottawa that's open for partial hours, and it's been getting really huge lineups in it, and physical distancing isn't being enforced. I'm wondering what the government's going to do about this, given that this is a government office and people seem to have to go into it to obtain their license stickers and get photo ID cards, things like that. Are you going to open more offices? Are you going to do a better job of enforcing physical distancing there? What kind of a message do you have?
So Mike, I'll get those numbers for you, because and the one just across from where I live, same thing. They have lineups. People are lining up 6 feet apart, and they're going down the sidewalk. But I'll find out the exact numbers, how many are open, and my question is, why aren't we opening these up? Let's open these up, practice social distancing. They have to get their sticker. They have to get their pictures for their license. Let's start opening them up. But I'll get that number, so tomorrow, Mike, I'll remember to answer that question for you. How many are open versus how many are closed?
Next question.
Next question comes from Robert Benzie from the Toronto Star. Please go ahead.
Hi, Premier. I just wanted to ask you, you've been saying over the last few days that you are going to come down very hard on commercial landlords who are evicting tenants. Why has your government refused to issue a moratorium on commercial evictions during the pandemic?
Well, you first want to give everyone a chance. This is going to roll out next week. I think they can apply May the 25th, if I'm not mistaken. And let's give everyone a chance. I think I've been very clear to landlords, especially the large landlords, that a few of them have messaged me and said, yeah, that's fine. We're going to go with the program. But I want to protect the small business owners. Let's give it a shot and see how it goes. I can't measure until we see the program start up next week.
And on a related matter, restaurants are really hurting because of the pandemic and the forced closure. Gila Martow, one of your caucus members, made quite an interesting speech yesterday in the legislature where she talked about the need to maybe free up more space, more public space, parking lots, parks, and so on, so that restaurants could expand their patios, amending the rules to expand patios. Is that something that you'd like to see that Ms. Martow was suggesting? It would certainly go ways to helping people keep their physical distance, I guess, if they can sit outside and have a drink or have a meal or so on. Is that something the government will consider?
Well, first of all, I want to give a shout out to Gila. She's incredible. She's a real thinker. She comes up with great ideas all the time, and it's something that we could bring to the health table and ask them, because you're right, the restaurants are hurting. But again, it all goes back to the numbers, especially over the last 4 or 5 days. We see these slowly creeping up. But I'll talk to Gila about that and bring it to the health table. But Gila comes up with great ideas all the time.
Next question.
Next question comes from Alison Jones from the Canadian Press. Please go ahead.
Hi, Premier.
Hi, Alison.
I wanted to follow up on one of Mike's questions. You're talking about the increases in the numbers that we've been seeing over the past few days. Have you heard any explanations on what is causing that? My understanding is that it would be too soon to really reflect anything from Tuesday's official reopening.
Yeah, no, I agree. But if you don't mind, I'm going to hand it over to the Minister of Health. Alison, thank you.
Thank you. As the Premier indicated, it is too soon to speculate, to say that it's because of the opening of businesses and so on, because some of this predates the reopening. But we are looking at where the new cases are coming from. The Chief Medical Officer of Health has acknowledged that there has been a slight increase in the number of cases, but he's still satisfied that overall we are on a downward trend. That's the most important thing of all of this. I think on Tuesday we had numbers of 427, then it went to 390. It's 413 today. So there's not a huge increase there. There was a decrease one day. So what we need to see is that gradual downward trend. It's not going to be as if it's all of a sudden going to take a dive and we're going to be down to number 200. It's going to be a slow incremental path. And all things considered, Dr. Williams is of the view that that's where we're headed, and we're taking our cues from him. But we will be watching this very closely as we get into next week, where we're going to really start to see what the effect is on public health from the changes that have happened as a result of stage 1. Then we'll really see what's happening out there in public health, and that will influence where we go from there.
And a follow-up for you as well, Minister Elliott. I wanted to ask about contact tracing. Yeah. How is Ontario doing on contact tracing? Did we actually hit that target that was identified for moving to stage 1 of 90% being identified within 24 hours?
Yes, we have hit that target. That was one of the key targets that Dr. Williams set for the reopening of stage 1. We're at least 93% now, and we're continuing to make improvements and adjustments to that. So we're very pleased with that number, but there is still more work to do, but we have hit the target, absolutely.
Next question.
Next question comes from Natasha MacDonald from Radio Canada. Please go ahead.
Hi, Natasha.
Hi, Hi, Premier. With daycare centers likely opening in phase 2, I'm wondering if your government's planning for the mass testing of daycare staff and kids, and if that would be the plan as well for teachers and students once schools reopen?
Yes, it will be. Yeah, we want to test as many people as possible, especially anyone around children. That will be in one of the categories that we're going to focus on. Again, nothing's more important. That should be a #1 priority, to make sure that we test anyone, not just screening, because we have some vigorous screening involved, but I want to get them tested too. And when we open up the economy even more, and it may be a month, I can't give you an exact time, but to give people confidence, there has to be more testing, and we're going to need the support of the people and the hot spots. There's certain regions that really stand out. They're glowing on the map like a lit up Christmas tree. We want to surge those areas, but we need the cooperation of the people in those areas, be it go by postal code. We know those areas, and those are the areas we bring in a mobile testing van, and we'll just start testing people in those certain areas. I'm obsessed with this testing, as you can tell. I'm a little wound up today because I want to see the testing. Simple. Let's see what happens next week, and let's start getting out there and testing everyone possible. That's the only way we can get our hands around this.
Follow up.
I want to ask you, Premier, about designated family caregivers. Quebec and Alberta, for instance, have protocols in place to allow them into long-term care homes. As you know, it's not the same as family visits. Caregivers provide quality of life care, harm reduction. So, Premier, I'm wondering why Ontario is continuing to ban essential family caregivers from understaffed care homes.
Well, I get, when you say caregivers, are you talking a loved one comes in and takes care of their mother or their father, and they want to help out and be a caregiver? I get lobbied every day about that. But I should hand this over to the Minister of Health. Thank you.
Well, we know this is a significant concern for many families. They're very concerned about their loved ones who are in long-term care homes. That I've also been lobbied by a number of people, including concerns that maybe their loved one may have signs of dementia, of Alzheimer's, and they really feel that their life is deteriorating and they're having more and more trouble coping. But the problem is that we've had so many outbreaks in our long-term care homes. Some of them are still red. They still have people from hospitals. They may have the armed forces there helping them. It's still too dangerous to let other people in right now. But this is going to be one of our first priorities, to figure out how that can happen in a safe and healthy way. We are looking at several alternatives, but right now we're not able to do it because we need to protect those residents. We need to make sure, because they are so vulnerable, that we don't let in any other people with COVID-19 or anyone else that can transmit this virus to them. So I know it's really difficult for families, but we just have to be very stringent right now for the next short while.
Next question.
Next question comes from Randy Rath from CHCH-TV. Please go ahead.
Hi, Premier.
Hi, Randy.
If I could just get you to clarify something that was just discussed. Are you talking about testing kids in daycares and students when they go back to school this fall?
No, I'm talking about the teachers, caregivers, and daycare areas. I want to make sure they get tested.
Okay.
Randy, I want as many people tested as absolute possible.
Yeah. Okay. My next question is, in the long-term care homes, most of the frontline workers haven't received any COVID bonus pay yet. The government hasn't distributed it, and the only people that have received it are ones that work in homes where the owners are willing to put the money up front and then collect it from the government later. What is the holdup in the government sending this money out, and do you think that homes should be putting money up front and paying their workers and getting it from you later?
Well, #1, everyone's going to get paid right from the get-go, so we're going to back pay them, and we're just making sure the money flows. We have the right amount of people on that list, because it seemed to start off small and it ended up growing like a mushroom. And but we're going to get going on that, and hopefully people will start seeing some additional pay, hopefully next week, but I'm gonna push them on that. But I don't think the long-term care homes should have to dole out the money. It's not their fault. We're working with the federal government, and between the feds, and which they were very generous, by the way, and ourselves, we have to get the money flowing. But no one's going to miss a week of pay per se for the $4 additional dollars. We're tracking that, and they'll get paid right from day one. Be retroactive.
Next question.
Next question comes from Christine Elliott from CP24. Please go ahead.
Hi, thank you so much,
Yes,
Premier. I'd like to follow up on some of the questions of my colleagues about stage 2. When we look at the numbers, if the criteria to hit stage 2 is a consistent minimum, at least, of 2 weeks of numbers going down, what would be the criteria that you would look at to say, you know what, we got to revert back to the way we were before for a bit and even halt stage 1 potentially, if you see perhaps a trend of numbers going up for the next little while? What is it that's going to say to you, we got to put a bit of a moratorium, a halt on some of the progress that we have been making or announcing in terms of reopening the economy?
Well, I'll rely on the health table. I'll pass it over to the Minister of Health, but if we all have seen an escalation continuously go up, we've seen it for the last few days. It hasn't been huge, but it's gone up, and it's concerning if we continue to see it go up. To give you an exact figure, I can't give you an exact figure, but we're going to keep an eye on it. As I said yesterday, I'm watching it like a hawk, and we'll rely on our health table, but I'll pass it over to the Minister of Health.
Well, there's actually 4 issues that need to be dealt with in terms of looking at either opening up the economy or perhaps closing some part of it down. One is the number of tests, of course, and we do need to see a downward trend for several weeks. That is going to be something that we follow on a daily basis, and Dr. Williams will comment that notwithstanding the blips we've seen over the last week or so, whether he still considers it a downward trend. Secondly, we need to make sure that we have hospital capacity to deal with any increases or surges in COVID-19 cases. So we're watching that very closely as well, even as a number of hospitals are doing their readiness assessment plans to see if they're ready to open up to elected procedures. We also need to see the contact tracing happening in over 90% of the cases within 24 hours. We are seeing that. And of course, we need to see significant testing volumes. So we need to see those volumes go up. As the Premier has indicated, he's on this one. And that's very important to me as well. So we need to get up to the 20,000 level of tests that we are able to do right now. So if all of those issues are in line, then we will review it. The Health Command Table will review it. Dr. Williams will review it, and then a decision will be made about where we proceed. Do we go to stage 2? Do we need to hold at stage 1? Or do we need to scale back on some of the things in stage 1 if we see a pattern or a trend there? So there's a number of issues that we have to look at concurrently, and we are doing that.
Thank you, Minister. My next question is for Minister Romano. Minister, so we've heard from a number of universities in the province, for example, York University, Ryerson University, saying that the majority of their fall learning will be online learning. Wondering what kind of clear direction you've given some of the colleges and universities in the province, or are you considering an order that they'll have to pursue online learning formally or totally for the fall semester?
Thank you very much for the question. We are looking at a number of different options, and of course, until we know where we are at as a province in the economic recovery, whether phase 2, whether phase 3, and what that looks like, and based on all the questions you've heard here today, there's still a lot of question marks. So what we are pursuing with the sector, and I have been having very frequent engagements with all of our university college, in fact, all of our post-secondary institution presidents, and the focus has been to, if I could put it very mildly, hope for the best but prepare for the worst. And in the preparation, being prepared for the worst case scenario, we're looking at some kind of a hybrid model. And so we're trying to focus on ensuring that we support our institutions to maximize on the course content that is available virtually, and ensuring that the programs that can be delivered online are delivered virtually. But with respect to courses that absolutely must require in-person attendance, for instance, areas like trades, certain graduate programs where labs are necessary, we are working on developing a proposal together with our post-secondary institutions that would focus on how we could bring in students safely, and then we would want to take that up through the table and to our Chief Medical Officer of Health to ensure that those can be done safely. And if they can, that would be the goal that would be what we would want to pursue.
Last question.
Last question comes from Colin Amello from CTV News. Please go ahead.
Hi, good afternoon, Premier. Just had a question again about testing. There seems to be a disconnect, as you mentioned, between what you want and what actually happens. I mean, you seem to be echoing the sentiments of a lot of people in this province that asymptomatic testing needs to be conducted almost immediately. You have the ultimate say in this province, though. Why isn't the command table acting on your requests in a timely manner?
Well, they're going to be acting, Colin, as sure as I'm talking to you right now. They're going to be acting. We're getting they're going to have a plan together, but I'll be on to them. I promise you. We will see the numbers. We saw the numbers jump up to close to 20,000. We never hit that target. We hit the 19, 18, but we need some consistency, and we have to start going into the public to hit those numbers, go back to long-term care and start testing, especially the frontline healthcare workers over at long-term care. We're going to have to test them again, and just to start doing mass testing. But hopefully I'll have a better answer for you on Monday. But I'm on to them. I promise you. I'm on to them from last night to today, and every day moving forward until I see those numbers.
And just in another topic, Premier, on weddings, we are just entering wedding season, and many couples have been talking about the fact that they've had to postpone their weddings until later on this year because they're hoping that they'll be able to gather with 200 of their friends or family at the very least. What should couples be expecting when it comes to wedding and wedding season? Will they actually be able to gather with a large number of people, or should they just call off weddings for 2020?
Well, I wouldn't want anyone to call off a wedding. I've talked to so many couples that have said, okay, we're going to do a small ceremony and then we'll do a larger celebration once we get through this. I just wish I could tell them a time they could get through it, but I've heard that numerous times. But they're going to have to just go with the program right now. I know it's not that great, and that's one of your big days, a birth of a child or your wedding day. And unfortunately, this virus has gotten in the way. And
thank you, everyone.
well, I want to give a shout out quickly. I've never done this, but with Minister Ross Romano, he's doing an incredible job with the colleges and universities, and I want to congratulate him, especially the leadership at the colleges and universities. He gave me a stat the other day, which was staggering. When we started going through all this, to get the students online, as he told me, and he gives the credit, he's a true leader, but he's trying to give the credit to colleges and universities, and I believe that. What he said would take 10 years, they did it in weeks, 100,000 courses online. So I want to give a shout out to all the colleges and universities. I brag about you everywhere I go. That is my #1 selling feature. The young people in the colleges and universities, our next generation. But you have an incredible leader with Minister Romano, and he's in full communication all the time with every college and university. So they make a great team, and I have all the faith in the colleges and universities to help us come up with maybe a vaccine or other areas. So just a quick shout out to all the students out there. You guys are all champions. Thank you.